Dr. Grace, you are in etiquette, grooming and etiquette. What role does it play in terms of health literacy?
Thank you so much. Good morning, everyone. What an honor to be here, and congratulations to Ruben. Very lovely to come here and sit. So for me, I am a grooming and etiquette consultant. I'm also in the area of skin and wellness education. My passion is bringing together wellness professionals in a room such that we work together. So I just want to talk about 4 things. The first one being collaboration, then respect, boundaries, and continuous education while we are all together. Firstly, it's important for us to all collaborate as professionals as we spread all of this information about health literacy, then to respect each other's education levels, and that is a part of how we educate the community about all aspects of health. Then to know our boundaries whenever you're addressing people, to know I've learned this much, this is where I end, and this is where the next professional begins. And lastly, to always continuously educate ourselves in every sphere or field of your profession that you are in. Now, coming back to the grooming and etiquette, being able to relate with individuals. So if you're talking to the community, if you're talking to professionals, if you're talking to authors, if you're talking to doctors, being able to relate with the community and professionals at the level that you understand, that they understand, where you can meet each other. So the big word that I want to use here is research. Whenever you now come, whether it's writing a book, doing some presentations, or going to approach different professional groups, research as to what aspect they are at. We are seeing a lot of abuse of the word health, a lot of abuse of the word wellness, everyone thinking like what the ambassador spoke about. There's TikTok education, there's YouTube education. People are just going to work where they haven't done their research, where they haven't been qualified, where they haven't been educated, and they're out there giving solutions. The number of people that come to me also asking about Ozempic, the number of people during the COVID era, like she mentioned, that had different solutions. It is important to respect the efficacy of your profession, of what you've studied, and let us collaborate and say, in this field, I'm not too confident. I'm going to refer you to Ruben, he's a pharmacist. I'm going to refer you to Kirsty, she's a nutritionist. So being able to know where you end and where the other person begins, and coming together for the benefit of the community.
Okay, I'm coming back again to the same question I asked the ambassador. What are you doing, grooming and etiquette, in the remote areas?
I would also like to copy the ambassador in the remote areas that, you know, they are one of the healthiest group of people. If you look at the food they eat, the lifestyle that they live, how well they exercise and moving their bodies continually. And I would also take the same response to say, trying to do a social media campaign for the community in the rural areas might not be effective, but working with the groups of influence. So if it is working with the educators, going and approaching schools and asking for workshops to be able to be done, working with the hospitals, with the local nurses is the best way to approach them and to speak at their level. And also not to bring, I'll say this in Shona, chirungu too much kwawari, because you're not able to relate with them. So going to their level and communicating with them, that's the best way that we can bring this etiquette, grooming, and health awareness to them.
Wow. Wow. This is very insightful.